Do disc herniations heal on their own? Not only is this an incredibly common question that I get asked all the time, but it's also something that I wondered about when I was going through back pain and had been told that I had a disc herniation. And this is a totally reasonable question and a thing to ask. Because if you get any other type of injury, like you break your arm or you roll your ankle, there's a pretty clear and straightforward answer to the question of whether or not that's going to heal. But when it comes to things like disc herniations and back pain in general, you'll be met with all kinds of confusing and conflicting information. So let's talk about what the research and the evidence actually says about disc herniations, how they heal, and their relationship to back pain. If you're new to the channel, welcome. My name is Dr. Nate. I'm a physical therapist and the founder of BackUnbroken. We help people get out of long-term lower back pain for good. So if you're looking for that, you're in the right place. All right, let's get right into it. Do disc herniations heal on their own? The short answer to this question is yes. We know from studies and research that most disc herniations have a favorable natural history, which means that in most cases, they're going to improve or heal all on their own without any special treatment. In fact, according to some pretty important research that we have on disc herniations, we usually see that the more severe the herniation or injury is, the more likely it is for that disc to heal or resorb on its own, which is kind of crazy, but it's also really positive news if you have a more severe disc herniation. So something like an extrusion or even a sequestration, which are the more severe types of disc herniations, actually tend to have higher rates of spontaneous healing over things like prolapses or disc bulges, which are more minor versions of disc herniations. Now, the one thing that I think is really important to clear up right away is what we mean by healing. When most people talk about healing when it comes to a disc herniation, they're usually talking about two separate things. The first is the actual anatomy of the disc, or what you can see if you got imaging. Meaning, does that disc herniation or protrusion end up reabsorbing back into the disc? That's typically how most people think about the disc healing, is they think about the image or how the anatomy actually looks. But then the other side of healing is your actual symptoms or how much pain you're getting. And right away, I think it's really important to differentiate between those two things and see them as very separate, because those two things are very often not one and the same, and actually are often very uncorrelated from each other. And again, we know this from research, because if we took a random sampling of 1,000 adults who have zero back pain and gave them all imaging, a huge percentage of those people who, again, have zero pain, zero symptoms, would have a disc herniation. And they're just completely unaware of it because it doesn't cause them any pain or disability. And then on the other end of the spectrum, we could take a random sampling of 1,000 people who do have back pain and have had some kind of diagnosis of a disc bulge or disc herniation in the past, and we could put them through imaging, and a huge percentage of them would have no active disc herniation, yet still have pain. So this is where we have to be a little bit more thoughtful with how we talk about healing from a disc herniation. Because again, according to the research, most disc herniations have favorable outcomes, and the more extreme the disc herniation, the higher the chance it has to spontaneously heal itself. But yet, regardless of all that, you can still be stuck with pain months, years, or even decades later. And that's where it becomes really important to look at your pain objectively and holistically instead of confining it to the one image that you got. Imaging can be important in some circumstances, but it does not tell the whole story, and it can't show pain. A lot of people will start their back pain journey with some kind of disc herniation diagnosis or pretty obvious signs and symptoms of a disc herniation. But then as time goes on, maybe your symptoms change a little bit, maybe the disc itself heals, but then you're still left with pain afterward. And then the other really important thing to know is that most people end up getting pain relief or symptom relief before the disc actually fully heals, which again, just gives us more and more evidence that the disc herniation itself is not the whole story, and that in most cases, we probably can't blame all of our pain on this one diagnosis. Now, the next logical question you might be asking yourself is, okay, if my disc herniation isn't the whole story or it's not the sole reason for my pain, then why am I still in pain? And that's where I think it's really important to dig a little bit deeper and look at all the secondary effects of something like a disc injury. So let's say you do have a disc injury. Let's say you're deadlifting at the gym one day, you go a little bit heavier than normal, You go to pick up the bar off the ground and you feel an immediate pop in your back, shooting symptoms down your leg, and you fall to the floor. So you get carted off to the ER, they give you some imaging, and they notice a pretty obvious disc herniation and nerve root compression. All right, so there it is, disc herniation and back pain. And for most people, that's the story they'll tell themselves for the rest of their life. That even a year, 2 years, 5 years, 10 years later, the back pain that they're experiencing is because of that initial disc herniation and injury. But we have to think about this carefully with research and physiology in mind. Again, we know that a large percentage of disc herniations, especially the more extreme ones, are going to heal on their own. And we also know that even if the disc never heals, you could be 100% out of pain and completely asymptomatic regardless of what the image says. But let's go back to our injury example and look at all the different secondary effects that can take place after the injury. All right, so you have your initial injury and that first week is terrible. You have a ton of pain, you can barely bend forward without excruciating symptoms. You stop working out, you start walking less, you're more stressed than you were before, sleeping is uncomfortable, moving is uncomfortable, thinking is uncomfortable. After that initial injury, every little thing you do is painful or uncomfortable or something that your body is trying to avoid. And what this leads to is a ton of compensation and decreased sensitivity within your body and nervous system. Through avoidance and continued pain feedback with certain movements, positions, and activities, your body starts to become more stiff and rigid, and it becomes easier and easier to set off those pain alarms. You start losing strength and muscle in your lower back, in your glutes, in your hips. You stop working out your legs as hard as you used to or at all. And these effects just spiral over and over, month after month, year after year. To the point where, let's say it's 2 years down the line, that initial disc herniation may be fully healed, maybe it's not, but it almost doesn't matter at that point because your body is now stuck in this loop of hypersensitivity and compensation. And again, this is a problem I see all the time, and it's a problem that I had myself, where you just keep telling yourself the same story over and over, that your pain is because of the disc herniation and you need it to heal, or you need to do some kind of special treatment to fix it. And meanwhile, you're neglecting all those other secondary effects that are likely playing a much larger role in your pain than your initial injury. So it's just something to think about if you have a disc herniation or you've gotten a diagnosis in the past, but the pain has persisted for a long period of time and it's interfering with lots of different aspects of your life, and it just doesn't seem to be going away with all the typical back pain and disc herniation treatments. As always, if you're sick of this loop and you want a step-by-step game plan for getting out of back pain for good, and you want my help along the way, I would really encourage you to check out what we do at Back Unbroken. I'll leave a link down below if you're interested. We have a full free masterclass that'll explain exactly how it all works. And if it's right for you, you can get started right away with a free trial. If you want to learn more about spine stuff and how your spine is not the enemy when it comes to back pain, watch this video right here. Thank you for watching. Don't give up hope. There's always a way out of back pain, and I'll see you in the next video.